loved one has died. 2. Could you come to the hospital? The client is not doing well. 3. The HCP has asked me to tell you of your family member's death. 4. Do you know whether the client wished to be an organ donor? 41. The nurse has been pulled from a medical unit to work on the vascular unit for the shift. Which client should the charge nurse assign to the medical unit nurse? 1. The client with the femoral popliteal bypass who has paresthesia of the foot. 2. The client with an abdominal aortic aneurysm who is complaining of low back pain. 3. The client newly diagnosed with chronic venous insufficiency who needs teaching. 4. The client with varicose veins who is complaining of deep, aching pain of the legs. 42. The charge nurse in the vascular intensive care unit assigns 3 clients to the staff nurse. The staff nurse thinks this is an unsafe assignment. Which action should the staff nurse implement first? 1. Refuse to take the assignment and leave the hospital immediately. 2. Tell the supervisor that he or she is concerned about the unsafe assignment. 3. Document his or her concerns in writing and give it to the supervisor. 4. Take the assignment for the shift but turn in his or her resignation. 48. Prioritization, delegation, and management of care for the NCLEX-RN registered exam client, Mr. C. Admit number, 432,165 allergies, ibuprofen 43. At 2,230, the nurse is preparing to administer pain medication to a male client who rates his pain as a 4 on the numeric pain scale. Which medication should the nurse administer? 1. Administer morphine 2 mg IVP. 2. Administer promethazine 12.5 mg IVP. 3. Administer hydrocodone 5 mg PO. 4. Administer ibuprofen 600 mg PO. 44. The matriarch of a family has died on the vascular unit. The family tells the nurse the daughter is coming to the hospital from a nearby city to see the body. Which intervention should the nurse implement? 1. Plan to allow the daughter to see the client in the room. 2. Take the client to the morgue for the daughter to view. 3. Request the family call the daughter and tell her not to come. 4. Explain to the daughter that the unit is too busy for family visitation. 45. The unit manager on the vascular unit is planning a change in the way post-mortem care is provided. Which is the first step in the change process? 1. Collect data. 2. Identify the problem. 3. Select an alternative. 4. Implement a plan. 46. The nurse is preparing to administer the third unit of packed red blood cells, PRBCs, to a client with a ruptured aortic aneurysm. Which interventions should the nurse implement? Select all that apply. 1. Hang a bag of D5NS to keep open, TKO. 2. Change the blood administration set. 3. Check the client's current vital signs. 4. Assess for allergies to blood products. 5. Obtain a blood warmer for the blood. Chapter 3 Peripheral Vascular Management 49 Questions Height, 65 inches Weight, 64.2 kg 141.2 pounds 0930 DN2 Day Nurse RN/DN Diagnosis, Chronic Vein Insufficiency Night Nurse RN/NN 1845 and 1730 and Evening Nurse RN/N Date, Today Medication 0701 to 1500 1501 to 2300 2301 to 0700 Morphine sulfate mg IVPQ 2 hours PRN Promethazine, Phenergan, 12.5 mg IVPQ 4 hours PRN Prochlorperazine, Compazine, 5 mg PO/TID PRN Hydrocodone, Vicodin, 5 mg PO/Q 4 to 6 hours PRN Ibuprofen, Motrin, 600 mg PO/Q 3 to 4 hours PRN Nurse's name/initials 47. The nurse and the unlicensed assistive personnel, UAP, are caring for clients on a vascular unit. Which task should the nurse delegate to the UAP? 1. Apply bilateral sequential compression devices to the client with deep vein thrombosis. 2. Accompany the client with thromboangiitis obliterans outside to smoke a cigarette. 3. Elevate the leg of the client who is 1 day postoperative femoral popliteal bypass. 4. Perform Doppler studies on the client with right upper extremity lymphedema. 48. The charge nurse on a vascular post-surgical unit observes a new graduate telling an elderly client's spouse not to push the client's patient-controlled analgesia, PCA, pump button. Which action should the charge nurse implement? 1. Encourage the visitor to push the button for the client. 2. Ask the nurse to step into the hallway to discuss the situation. 3. Discuss the hospital protocol for the use of PCA pumps. 4. Continue to perform the charge nurse's other duties. 49. Which client should the nurse assess first after receiving the shift report? 1. The client with the right above the knee amputation who is complaining of right foot pain. 2. The client with arterial hypertension who is complaining of a severe headache. 3. The client with lymphedema who has 4+ pitting edema of the left lower leg. 4. The client with gangrene of the right foot who has a foul-smelling discharge. 50. The nurse observes an LPN crushing nifedipine, Procardia XL, before administering the medication to a client with arterial hypertension who has difficulty swallowing pills. Which intervention should the nurse implement first? 1. Tell the LPN to take the client's blood pressure. 2. Take no action since this is appropriate behavior. 3. Show the LPN where to find pudding for the client. 4. Tell the LPN this medication cannot be crushed. 51. A 90-year-old male client was recently widowed after more than 60 years of marriage. The client was admitted to a long-term care facility and is refusing to eat. Which intervention is an example of the ethical principle of autonomy? 1. Place a nasogastric feeding tube and feed the client. 2. Discuss why the client does not want to eat anymore. 3. Arrange for the family to bring food for the client. 4. Allow the client to refuse to eat if he wants to. 52. The nurse is admitting a client with an abdominal aortic aneurysm who is a member of the Church of Jesus Christ of Latter-day Saints, Mormon. Which action by the nurse indicates cultural sensitivity to the client? 1. The nurse does not insist on administering a blood transfusion. 2. The nurse pins the client's amulet to the client's pillow. 3. The nurse keeps the client's undershirt on during the bath. 4. The nurse notifies the client's curandero of the admission. 53. Which client should the nurse on the vascular unit assess first after receiving the shift report? 1. The client with lymphedema whose ABG results are pH 7.33, PAO 289, PACO 247, HCO 325. 2. The client with Raynaud's phenomenon who has bluish cold upper extremities. 3. The client with chronic venous insufficiency who has an ulcerated area on the right foot. 4. The client receiving intravenous heparin infusion who has a PTT on 78. 50. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 54. The charge nurse of a long-term care facility is making assignments. Which client should be assigned to the most experienced unlicensed assistive personnel, UAP? 1. The client with arterial occlusive disease who must dangle the legs off the side of the bed. 2. The client with congestive heart failure who is angry about the family not visiting. 3. The client with an above-the-knee amputation who needs a full-body lift to get in the wheelchair. 4. The client with Berger's disease who is particular about the way things are done. 55. The client complains of chest pain on deep inspiration. Which intervention should the nurse implement first? 1. Place the client on oxygen. 2. Assess the client's lungs. 3. Notify the respiratory therapist. 4. Assess the client's pulse oximeter reading. 56. Which of the staff nurse's personal attributes is an important consideration for the unit manager when discussing making an experienced nurse a preceptor for new graduates? Select all that apply. 1. The nurse's need for the monetary stipend. 2. The nurse's ability to organize the work. 3. The ability of the nurse to interact with others. 4. The quality of care the nurse provides. 5. The nurse's willingness to be a preceptor. 57. The nurse just received the AM shift report. Which client should the nurse assess first? 1. The client who is 6 hours post-op vein ligation who has absent pedal pulses. 2. The client diagnosed with deep vein thrombosis who is complaining of calf pain. 3. The client with Raynaud's disease who has throbbing and tingling in the extremities. 4. The client with Berger's disease who has intermittent claudication of the feet and arms. 58. The intensive care department nurse is calculating the total intake for a client diagnosed with hypertensive crisis. The client has received 950 ml of D5W, 2 IV PB of 100 ml of 0.9% NS, 16 ounces of water, 8 ounces of milk, and 6 ounces of chicken broth. The client has had a urinary output of 2,200 ml. What is the total intake for this client? 59. The nurse is teaching the client diagnosed with arterial occlusive disease. Which statement indicates the client needs more teaching? 1. I will wash my legs and feet daily in warm water. 2. I should buy my shoes in the afternoon. 3. I must wear knee-high stockings. 4. I should not elevate my legs. 60. The nurse is caring for clients on a vascular unit. Which nursing task is most appropriate to delegate to an unlicensed assistive personnel, UAP? 1. Tell the UAP to obtain the glucometer reading of the client who is dizzy and lightheaded. 2. Request the UAP to elevate the feet of the client with chronic venous insufficiency. 3. Ask the UAP to take the vital signs of the client who has numbness of the right arm. 4. Instruct the UAP to administer a tap water enema to the client with an aorta aneurysm. 61. A client is 2 days postoperative abdominal aortic aneurysm repair. Which data require immediate intervention from the nurse? 1. The client refuses to take deep breaths and cough. 2. The client's urinary output is 300 ml in 8 hours. 3. The client has hypoactive bowel sounds. 4. The client's vital signs are T98, P68, R16, and BP110/70. Chapter 3 Peripheral Vascular Management 51 Questions Height, 72 inches Date, Today Signature/Initial 62. The nurse is caring for clients on a vascular surgical floor. Which client should be assessed first? 1. The client who is 2 days postoperative right below the knee amputation who has phantom pain in the right foot. 2. The client who is 1 day postoperative abdominal aortic aneurysm who is complaining of numbness and tingling of both feet. 3. The client with superficial thrombophlebitis of the left arm who is complaining of tenderness to the touch. 4. The client with arterial occlusive disease who is complaining of calf pain when ambulating down the hall. 63. The nurse is caring for a client receiving heparin sodium via constant infusion. The heparin protocol reads to increase the 4 rate by 100 units/hour if the PTT is less than 50 seconds. The current PTT level is 46 seconds. The heparin comes in 500 ml of D5W with 25,000 units of heparin added. The current rate on the 4 pump is 20 ml per hour. At what rate should the nurse set the pump? 64. The unlicensed assistive personnel, UAP, is caring for a client diagnosed with chronic venous insufficiency. Which action would warrant immediate intervention from the nurse? 1. The UAP assists the client to apply compression stockings. 2. The UAP elevates the client's leg while sitting in the recliner. 3. The UAP assists the client to the bathroom for AM care. 4. The UAP is cutting the client's toenails after soaking the client's feet in tepid water. 65. The nurse has just received the AM shift report. Which client would the nurse assess first? 1. The client with a venous stasis ulcer who is refusing to eat the high-protein meal. 2. The client with varicose veins who is refusing to wear thromboembolic hose. 3. The client with arterial occlusive disease who is refusing to elevate their legs. 4. The client with deep vein thrombosis who is refusing to stay in the bed. 66. At 1000, a client who has had femoral popliteal surgery on the right leg is complaining of severe right upper quadrant pain of 10 out of 10 on the pain scale. Based on the information in the chart below, what should the nurse do for the client? 1. Administer the oxycodone and acetaminophen PO. 2. Help the client to practice guided imagery for the pain. 3. Call the surgeon for an increase in pain medication. 4. Administer a dose of morphine to the client. 52. Prioritization, delegation, and management of care for the NCLEX-RN registered exam client name, Mr. B.A. Account number, 010-1223 allergies, codeine weight in pounds, 220 weight in kg, 100 date of birth, February 5, 1982 medication morphine sulfate 2 mg IVP every 4 hour PRN pain oxycodone 7.5/acetaminophen 325 mg PO every 3 hours PRN pain Maalox 30 ml PO PRN indigestion nitroglycerin 0.4 mg/SL every 5 minutes up to 3 tablets PRN chest pain 23012070004455NN0030NN0545NN night nurse RN/NN0701-1500-0845 DN day nurse RN/DN1501-2367. The client on a surgical unit is scheduled to receive an antibiotic piggyback over 1 hour. The piggyback is prepared in 150 ml of solution. At what rate should the nurse set the piggyback if the administration set delivers 20 drops per ml? 68. The client in the day surgical unit is scheduled to have vein ligation on the right leg. The client states, "I am having surgery on my left leg." Which intervention should the nurse implement first? 1. Have the client sign the surgical operative permit. 2. Assess the client's neurological status. 3. Ask when the client last took a drink of water or ate anything. 4. Call a timeout until clarifying which leg is having the vein ligation. 69. The 63-year-old client is diagnosed with an abdominal aortic aneurysm. Which area on the figure should the nurse place a stethoscope to assess for a bruit? 1A2, B3, C4, D70. The male post-op femoral popliteal client notifies the desk via the intercom system he has fallen and is now bleeding. Which interventions should the nurse implement? Rank in order of performance. 1. Apply pressure directly to the bleeding site. 2. Notify the surgeon of the fall and the bleeding. 3. Redress the site with a sterile dressing. 4. Assist the client to a recumbent position in the bed. 5. Make out an occurrence report and document the fall. Chapter 3 Peripheral Vascular Management 53 Questions ADCB 54 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam DH is the charge nurse on a medical unit. She has 3 primary nurses, JC, who has been a nurse on the unit for 12 years. BN, who has been on the unit for 1 year, and PN, who is a new graduate. There are 3 UAPs, BA, B, and AM. 1. JC just received the AM shift report. Which client should JC assess first? 1. The client diagnosed with coronary artery disease who has a BP of 170/100. 2. The client diagnosed with deep vein thrombosis who is complaining of calf pain. 3. The client diagnosed with arterial occlusive disease who has intermittent claudication. 4. The client diagnosed with aortic abdominal aneurysm who has low back pain. 2. Which assessment data would warrant immediate intervention by DH, charge nurse for the client diagnosed with arterial occlusive disease? 1. The client has decreased hair on his or her calf. 2. The client has no palpable dorsal pedal pulse. 3. The client has paralysis and paresthesia. 4. The client hangs his or her legs off the side of bed. 3. The nurse and the unlicensed assistive personnel, UAP, are caring for a client who is 4 hours postoperative right femoral, popliteal bypass surgery. Which nursing task should JC delegate to the UAP? 1. Check the client's pedal pulse with the Doppler. 2. Assist the client to ambulate down the hall. 3. Review the client's neurovascular assessment. 4. Elevate the client's leg on 2 pillows. 4. Which interventions should DH discuss with the client diagnosed with atherosclerosis? Select all that apply. 1. Take a baby aspirin daily. 2. Eat a low-fat, low-cholesterol diet. 3. Maintain a sedentary lifestyle as much as possible. 4. Decrease all foods high in fiber. 5. Walk 30 minutes a day at least 3 days a week. 5. The client is 2 days postoperative abdominal aortic aneurysm. Which intervention should BN implement first when making initial rounds? 1. Auscultate the client's bowel sounds. 2. Assess the client's surgical dressing. 3. Encourage the client to splint the incision. 4. Monitor the client's intravenous therapy. 6. The client is diagnosed with a small abdominal aortic aneurysm. Which statement by the client indicates to BN the client needs more discharge teaching? 1. I should not lift more than 5 pounds for at least 4 to 6 weeks. 2. I attend a support group to help me quit smoking. 3. I will need to wear a truss at all times after the surgery. 4. If I get a temperature of 101 or higher I will call my doctor. Peripheral vascular disease clinical scenario 7. PN is assigned the following clients. Which client should PN assess first? 1. The client who is 4 days postoperative abdominal surgery and is complaining of abdominal pain when ambulating. 2. The client who 1 day postoperative femoral popliteal repair has a 3+ posterior tibial pulse. 3. The client who had an abdominal aortic repair who had a urine output of 150 ml in the last 8 hours. 4. The client with deep vein thrombosis who is complaining about being unable to get out of the bed. 8. PN is caring for a client receiving heparin sodium via constant infusion. The heparin protocol reads to decrease the 4 rate by 100 units/hour if the PTT is between 78 to 90 seconds. The current PTT level is 85 seconds. The heparin comes in 500 ml of D5W with 25,000 units of heparin added. The current rate on the 4 pump is 18 ml per hour. At what rate should the nurse set the pump? 9. The unlicensed assistive personnel, UAP, is caring for the client diagnosed with chronic venous insufficiency. Which action would warrant immediate intervention by PN? 1. The UAP is elevating the client's legs on 2 pillows. 2. The UAP is massaging the client's calf muscles. 3. The UAP is instructing the client to stay in the bed. 4. The UAP is calculating the client's shift intake and output. 10. An 80-year-old client is being discharged home after having surgery to debride a chronic venous ulcer on the right ankle. Which referral is most appropriate for DH, the charge nurse, to make? 1. Hospice. 2. Home health. 3. Physical therapist. 4. Cardiac rehabilitation. Chapter 3 Peripheral Vascular Management 55 Clinical Scenario 56 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. Intermittent claudication is a symptom of arterial occlusive disease, therefore, this client does not need to be assessed first. 2. The client with calf pain could be experiencing deep vein thrombosis, DVT, a complication of immobility, which may be fatal if a pulmonary embolus occurs, therefore, this client should be assessed first. 3. The client experiencing low back pain when sitting in a chair should be assessed but not prior to the client with suspected DVT. 4. The nurse should address the client's concern about the food, but it is not priority over a physiological problem. Content, medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions, when deciding which client to assess. RST, The test taker should determine whether the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected options, the test taker should determine which situation is more life-threatening. 2.1. Therapeutic levels for PTT should be 11/2 to 2 times the normal value, which is 39 seconds, therefore, this client is at risk for bleeding. The prolonged PTT indicates the client is receiving heparin, drug of choice to treat DVT. The nurse should stop the infusion and follow the facility protocol. 2. The hemoglobin is within normal range and the client with Raynaud's disease does not have a problem with bleeding. 3. The WBC count is elevated, normal is 5,000 to 10,000, but it would be elevated in a client who has an infection such as venous stasis ulcer. 4. The nurse should notify the HCP on rounds of any laboratory data that are abnormal but not immediately life-threatening. The triglyceride level is high, but it will take weeks to months of a heart-healthy diet, exercise, and possibly medications to lower this level. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, synthesis making nursing decisions, when a question asks for IMD. I8 Intervention. The test taker must decide whether there is an intervention the nurse can implement immediately or whether the HCP must be notified. If the data are abnormal but not life-threatening, then the option can be eliminated as a possible correct answer. 3.1. The nurse should first assess the client to determine the status prior to notifying the HCP. 2. The unlisted assistive personnel, UAP, has notified the nurse of a potentially serious situation. The nurse must first assess the client prior to taking any action. 3. The nurse might place the client in Trendelenburg position once cardiovascular shock is determined. 4. The nurse should immediately go to the client's room to assess the client. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions, anytime the nurse receives information about a client, who may be experiencing a complication, from another staff member, the nurse must assess the client. The nurse should not make decisions about the client's needs based on another staff member's information. 4.1. Because laboratory values called into a unit usually include critical values, the charge nurse should tell the unit secretary to show me any lab information that is called in immediately. The charge nurse must evaluate this information immediately. 2. Posting laboratory results is the responsibility of the laboratory staff, not the nursing staff. 3. This is unrealistic because laboratory data are important information that must be called into a unit when there is a critical value so that immediate action can be taken for the client's answers and rationales. Chapter 3 Peripheral Vascular Management 57 Welfare. The secretary must know how to process the information. 4. The unit secretary should verify the information by repeating back the information at the time of the call, not by making a second telephone call to the lab. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The test taker must be knowledgeable of the roles of all members of the multidisciplinary healthcare team, as well as HIPAA rules and regulations. The nurse must ensure the healthcare team member knows appropriate actions to take in specific situations. These will be tested on the NCLEX-RN registered. 5.1. Vitamin K is the antidote for warfarin, Coumadin, overdose and is administered to a client when his or her INR level is above the therapeutic 2 to 3, therefore, the nurse should question administering this medication. 2. Inderal is administered to clients diagnosed with hypertension. Therefore, the nurse would not question administering this medication. 3. Procardia reduces the number of vasospastic attacks in clients with Raynaud's disease, therefore, the nurse should question administering this medication to a client with hypotension. 4. Vasotec, an ACE inhibitor, is administered to clients with diabetes to help prevent diabetic nephropathy. The nurse would not question administering this medication. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, safe and effective care environment, safety and infection control, cognitive level, analysis making nursing decisions. The nurse must be aware of interventions that must be implemented prior to administering medications. The nurse must know what to monitor prior to administering medications because untoward reactions and possibly death can occur. 6.1. This client is exhibiting signs/symptoms of a potentially fatal complication of DVT pulmonary embolism. The nurse should assess this client first. 2. Intermittent claudication of the feet, hands, and arms is a symptom of Buerger's disease, therefore, this client should not be assessed first. 3. The client with an aortic aneurysm is expected to have an audible bruit and does not indicate any life-threatening condition, therefore, this client does not need to be assessed first. 4. The client with acute arterial ischemia should have unpalpable pedal pulses to be considered a medical emergency, therefore, this client does not need to be assessed first. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. The test taker must determine which sign/symptom is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of the signs/symptoms of a variety of disease processes. 7.1. Because the client has been on the daily aspirin for more than a year, the nurse should assess for bleeding by asking questions such as, do your gums bleed after brushing teeth, or do you notice blood when you blow your nose? 2. Because aspirin can cause gastric distress, the nurse could instruct the client to stop taking it. However, because this is a daily medication being used as an antiplatelet agent, the nurse should provide information that would allow the client to continue the medication. 3. The nurse should realize the stomach discomfort is probably secondary to daily aspirin, and enteric-coated aspirin would be helpful to decrease the stomach discomfort and allow the client to stay on the medication, but the nurse should first assess the client for bleeding. 4. Because aspirin is not a prescription medication, the nurse can recommend a different form of aspirin, such as one that is enteric-coated. However, if the enteric-coated aspirin does not relieve the pain, the HCP should then be notified. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. Assessment is the first step of the nursing process, and the test taker should use the nursing process or some other systematic process to assist in determining priorities. Answers 58. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 8. 1. This statement indicates the new graduate needs more teaching because the nurse is responsible for delegating the right task to the right individual. Absolutely no one works on the nurse's license but the nurse holding the license. 2. The nurse does retain accountability for the task delegated, therefore, the new graduate does not need more teaching. 3. The nurse must make sure the unlicensed assistive personnel, UAP, is able to perform the task safely and competently, therefore, the new graduate does not need more teaching. 4. The nurse must make sure the delegated task was completed correctly, therefore, the new graduate does not need more teaching. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions, an RN cannot delegate assessment, teaching, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions requiring nursing judgment. The nurse must be aware of delegation rules and regulations. 9.1. The manufacturer of a product would provide biased information and would not provide the best data to support a change proposal. 2 research studies with a limited number of participants indicate the need for further research and would not be the best research to support a change proposal. 3. Research should provide clear statistical data that support the research problem or hypothesis. 4. The more research articles there are that support a change proposal, the more valid is the information, which increases the possibility for change to be considered by the healthcare facility. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, evaluation, client needs, physiological integrity, reduction of risk potential, cognitive level, knowledge making nursing decisions. The NCLEX-RN registered blueprint includes nurse ING care based on evidence-based practice. The nurse must be knowledgeable of nursing research. 10.1. The unlicensed assistive personnel, UAP, can clean the perineal area of a client who is on bed rest and who has an indwelling catheter. Because the client is stable, this nursing task could be delegated to the UAP. 2. The UAP can obtain the client's intake and output, but the nurse must evaluate the data to determine whether interventions are needed or whether interventions are effective. 3. A client who is third spacing is unstable and in a life-threatening situation, therefore, the nurse cannot delegate the UAP to give this client a bath. 4. This is a medication enema, and the UAP cannot administer medications. In addition, if a cation exchange resin enema is ordered, the client is unstable and has excessively high serum potassium, K+, level. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. An RN cannot delegate assessment, teaching, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions requiring nursing judgment. 11.1. Although the nurse could request another unlicensed assistive personnel, UAP, to perform the task, this is not the best action because the nurse should demonstrate applying SCDs so that the UAP can learn how to complete the task. 2. This is the priority action because the nurse will ensure the UAP knows how to apply SCDs correctly, thereby enabling the nurse to delegate the task to the UAP successfully in the future. 3. The nurse could do the task, but if the UAP is not shown how to do it, then the UAP will not be able to perform the task the next time it is delegated. 4. The UAP could watch a video demonstrating this task, but the priority action is that the nurse should demonstrate SCD application to the UAP. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application making nursing decisions. The nurse cannot delegate any task in which the UAP admits to not being able to perform. It is the nurse's responsibility to know what can be delegated and Chapter 3 Peripheral Vascular Management 59 when the nurse may have to complete the task if the UAP is not competent to do so. 12.1. The nurse should not assign assessment of a client to an LPN even if the client is stable. 2. The LPN cannot initiate administration of blood, therefore, this task must be completed by the nurse. 3. The LPN can administer medications. Therefore, the LPN could hang a bag of heparin on an 4 pump to this client. 4. The nurse must assess for dysrhythmias during the insertion, and the nurse assisting the HCP should be experienced in inserting the line. An LPN pulled from another unit should not be assigned this task. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse cannot assign assessment, teaching, evaluation, or an unstable client to a LPN. The LPN can transcribe HCP orders and can call HCPs on the phone to obtain orders for a client. 13.1. The client is having signs/symptoms of a blood transfusion reaction. The nurse must stop the transfusion immediately and then assess the client's vital signs. 2. The HCP needs to be notified, but not before the nurse stops the blood transfusion. 3. The nurse should maintain a patent for so that medications can be administered, but this is not the first intervention. 4. Anytime the nurse suspects the client is having a reaction to blood or blood products, the nurse should stop the infusion at the spot closest to the client and not allow any more of the blood to enter the client's body. This is the nurse's first intervention. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application making nursing decisions. The nurse should remember, if a client is in distress and the nurse can do something to relieve the distress, it should be done first, before assessment. The test taker should select an option that directly helps the client's condition. 14.1. A research article should answer the question why. Why was the research done? This statement indicates the charge nurse understands how to read a research article. 2. The cost of the research is not pertinent when reading a research article and determining whether the research supports evidence-based practice. This statement indicates the charge nurse does not understand how to read a research article. 3. A research article should answer the question what research method was used. This statement indicates the charge nurse understands how to read a research article. 4. A research article should answer the question where, in what setting was the research conducted. This statement indicates the charge nurse understands how to read a research article. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, evaluation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. The NCLEX-RN registered blueprint includes nursing care based on evidence-based practice. The nurse must be knowledgeable of nursing research. 15.1. The nurse should write the order on the HCP's order and write per telephone order. 2. But this is not the nurse's first intervention. 2. The nurse does not need to have another nurse verify the HCP's telephone order. 3. The Joint Commission has implemented this requirement for all telephone orders. The nurse should document on the HCP's order repeat order verified. 4. The nurse should transcribe the order to the MAR, but it is not the first intervention. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, knowledge making nursing decisions. The NCLEX-RN registered blueprint include nursing care that is ruled by legal requirements as well as rules and regulations of the Joint Commission, Centers for Medicare and Medicaid Services, Centers for Disease Control and Prevention, and the Occupational Safety and Health Administration. The nurse must be knowledgeable of these standards. 16.1. The therapeutic level for a client on warfarin, Coumadin, is an INR of 2 to 3, therefore, this client does not warrant intervention. Answer 60. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 2. These hemoglobin/hematocrit levels are a little low but not so critical that this would warrant intervention by the charge nurse. 3. A platelet count of less than 100,000 per milliliter of blood indicates thrombocytopenia, therefore, this client warrants intervention by the charge nurse. 4. This is a normal red blood cell count, therefore, the charge nurse would not need to intervene. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis. Making nursing decisions, the nurse must be knowledgeable of normal laboratory values. These values must be memorized and the nurse must be able to determine if the laboratory value is normal for the client's disease process or medications the client is taking. 17.1. This statement is not supporting the night shift and makes the unit look bad. The nurse should not badmouth the night shift. 2. The nurse has no idea what happened that delayed answering the call light, it could have been a code or other type of life-threatening situation. The day shift primary nurse may not be able to answer the light in some certain situations and should not falsely reassure the client. 3. The nurse should have someone come talk to the client who is in a position to then investigate what happened on the night shift and determine why this happened. The day shift primary nurse does not have this authority. 4. This is negating the client's feeling, and the client does not need to know what was going on in the critical care unit. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, application. Making nursing decisions, there will be management questions on the NCLEX-RN registered. In many instances, there is no test-taking strategy for these questions. The nurse must be knowledgeable of management issues. 18. Correct answer: 3, 2, 1, 4, 5, 3. The client must agree to the risks and benefits of a blood transfusion before the nurse can administer the blood product. This is the first intervention. 2. The nurse has only 30 minutes from the time the blood is retrieved from the blood bank until the transfusion is initiated. The nurse should make sure the client has a patent for access before obtaining the blood from the blood bank. 1. The nurse can obtain the unit of packed cells when the client has signed the permit and has a patent for access. 4. The nurse should always check the blood product with another nurse at the client's bedside against the client's hospital identification band and blood bank cross-match band. 5. After the nurse has followed the procedure to ensure the correct blood product is being administered, with a second nurse, then the transfusion of packed cells can be initiated. The blood is initiated at a slow rate 10 ml per hour for the first 15 minutes so that the nurse can observe the client for potential complications. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. Making nursing decisions, this is an alternate type of question included in the NCLEX-RN registered blueprint. The nurse must be able to perform skills in the correct order. Obtaining informed consent and performing an assessment should always be the first interventions. 19.1. This should be an anticipated order if the nurse suspects a pulmonary embolus, but it is not the first intervention. 2. The nurse should suspect the client has a pulmonary embolus, a complication of the thrombophlebitis. Pulmonary emboli decrease the oxygen supply to the body, and the nurse should immediately administer oxygen to the client. 3. An anticoagulant infusion will be ordered for the client once it is determined that the client is experiencing a pulmonary embolus. 4. Getting oxygen to the body is a priority. Telling the client not to ambulate can be done after initiating the oxygen. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application. Chapter 3 Peripheral Vascular Management 61 Making nursing decisions. Physiological problems have the highest priority when deciding on a course of action. If the client is in distress, then the nurse must intervene with a nursing action that attempts to alleviate or control the problem. The test taker should not choose a diagnostic test if there is an option that directly treats the client. 21. The therapeutic level for digoxin is 0.8 to 2.0, so this warrants notifying the HCP. 2. There is no serum blood level to monitor Levinox, which is a low molecular weight heparin administered to prevent deep vein thrombosis. 3. The platelet level is within normal level of 150,000 to 400,000, so this would not warrant notifying the HCP. 4. The normal potassium level is 3.5 to 5.5 milliequivalent/L, so this result would not warrant notifying the HCP. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, the nurse must be knowledgeable of AL laboratory values. These values must be memorized and the nurse must be able to determine if the laboratory value is normal for the client's disease process or for medications the client is taking. 21.1. This is the correct procedure to help preserve the fingers so the surgeon can reattach the fingers, but is not the first intervention. 2. Elevating the right arm will help decrease bleeding, but it is not the first intervention. 3. The nurse should first put on non-sterile gloves to protect from getting any blood-borne diseases. 4. Applying direct pressure is an appropriate intervention, but the first intervention is to apply gloves to protect the nurse. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application. Making nursing decisions, the test taker must remember, if the client is in distress, do not assess, but standard precautions take priority. The nurse must always put standard precautions as a priority when caring for all clients, especially when blood and body fluids are present. 22.1. The unlicensed assistive personnel, UAP, could escort the client to the room so that the LPN could be assigned tasks that are within the LPN's scope of practice. 2. The UAP can make sure the room is clear of the previous client's gown and equipment used with the previous client. The UAP can also make sure there are gowns, tongue blades, and additional equipment in the examination room. 3. The LPN can administer medication. Therefore, it would be more appropriate to assign this task to the LPN, so that the RN could be assigned tasks that are beyond the scope of practice of an LPN and within the RN scope of practice. 4. The clinic secretary is unlicensed personnel and does not have the authority to call in a new prescription for a client. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, when the test taker is deciding which option is the most appropriate task to delegate/assign, the test taker should choose the task that requires each member of the staff to function within his or her full scope of practice. Do not assign a task to a staff member that requires a higher level of expertise than the staff member has, and do not assign a task to a staff member when the task could be delegated/assigned to a staff member with a lower level of expertise. 23.1. The nurse should discuss the client's comment, but it is not the nurse's first intervention. 2. The nurse should first take the client's BP correctly and address the client's concern. 3. If the nurse's BP reading and the UAP's BP reading are close to the same, the nurse could reassure the client that the UAP does know how to take BP readings. However, this is not the nurse's first intervention. For this is an appropriate action, but it is not the first intervention. The nurse is responsible for making sure the UAP has the ability to perform any delegated tasks correctly. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application answers 62 prioritization, delegation, and management of care for the NCLEX-RN registered exam. Making nursing decisions, the nurse should address client needs first, including answering the client's questions, verifying the client's vital signs, or assessing the client if the client is not in distress. 24.1. Intravenous push medications cannot be assigned to an LPN. It is the most dangerous route for administering medication, and only an RN, or HCP, can perform this task. 2. The client who is diagnosed with a pulmonary embolus is not stable. Therefore, this medication is not the best medication to be assigned to the LPN. 3. Trental is a PO medication prescribed specifically to treat intermittent claudication. It increases erythrocyte flexibility and reduces blood viscosity. 4. The client may be having a myocardial infarction. Therefore, this client is unstable and should not be assigned to an LPN. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, the test taker must determine which option absolutely is included within the LPN scope of practice. LPNs are not routinely taught how to administer intravenous push medications. The test taker must also determine which client is the most stable, which makes this an accept question. 3. Clients are either unstable or have potentially life-threatening conditions and should not be assigned to an LPN. 25.1. The nurse should realize the client probably has deep vein thrombosis, which is a medical emergency. The HCP should be notified immediately so the client can be started on 4-heparin and admitted to the hospital. 2. This information may be needed, but the nurse should notify the HCP based on the signs/symptoms alone. 3. A neurovascular assessment should be completed, but not before notifying the HCP. The signs/symptoms alone indicate a potentially life-threatening condition. 4. The client's leg should be elevated, but this is a potentially life-threatening emergency and the nurse should first call the HCP. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis. Making nursing decisions, the test taker needs to read all of the options carefully before choosing the option that says, notify the HCP. If any of the options will provide information the HCP needs to know in order to make a decision, the test taker should choose that option. If, however, the HCP does not need any additional information to make a decision and the nurse suspects the condition is serious or life-threatening, the priority intervention is to call the HCP. 26.1. The nurse should first determine whether there is a fire or whether someone accidentally or purposefully pulled the fire alarm. Because this is a clinic, not a hospital, the nurse should keep calm and determine the situation before taking action. 2. The nurse should not evacuate clients, visitors, and staff unless there is a real fire. 3. The nurse should assess the situation before contacting the fire department. 4. This is an appropriate intervention, but this is not the first intervention. The nurse should first assess to determine whether there is a fire. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, knowledge making nursing decisions, the nurse must be knowledgeable of emergency preparedness. Employees receive this information in employee orientation and are responsible for implementing procedures correctly. The NCLEX-RN registered blueprint includes questions on safe and effective care environment. 27.1. The clinic nurse should allow the director to address sexual harassment allegations. This is a matter that should be handled legally. 2. This is an appropriate question to ask when investigating sexual harassment allegations, but the clinic nurse should allow the director of nurses to pursue the situation. 3. The clinic nurse is responsible for taking the appropriate action when sexual allegations are reported. This statement shows that the clinic nurse is not taking the allegations seriously and could result in disciplinary action against the nurse. 4. This is the most appropriate response because sexual harassment allegations are a legal matter. The clinic nurse implemented the correct action by making sure the unlicensed assistive personnel, UAP, Chapter 3 Peripheral Vascular Management 63 reported the allegation to the Director of Nurses. Content, medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions, there will be management case. Shins on the NCLEX-RN registered. In many instances, there is no test-taking strategy for these questions. The nurse must be knowledgeable of which management issues must comply with local, state, and federal requirements. 28.1. The clinic nurse should not discuss the staff nurse's statement with the pharmaceutical representative because the staff member's behavior is unethical and could have repercussions. The clinic nurse should notify the director of nurses. 2. This behavior is unethical and is making promises that the staff nurse may or may not be able to keep. Because this situation includes the HCP, an outside representative, and the staff nurse, this situation should be reported to the Director of Nurses for further action. 3. This behavior must be reported. This is bribing the pharmaceutical representative and using a meeting with the HCP as the reward. 4. The clinic nurse should maintain the chain of command and report this to the nursing supervisor, not to the HCP. Content, medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions, there will be management case. Shins on the NCLEX-RN registered. In many instances, there is no test-taking strategy for these questions. The nurse must be knowledgeable of management issues. 29.1. The nurse should document the results in the client's chart, but this is not the nurse's first intervention. 2. The therapeutic value for INR is 2 to 3, levels higher than that increase the risk of bleeding. The nurse should first contact the client and determine whether she has any abnormal bleeding and then instruct the client to not take any more Coumadin. 3. The nurse should notify the client's HCP, but the nurse should first determine whether the client has any abnormal bleeding so that can be reported to the HCP. 4. The client will need to have another INR drawn, but it is not the nurse's first intervention. Content, medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions, any time the nurse receives information from another source about a client who may be experiencing a complication, the nurse must assess the client. In this scenario, the nurse assesses the client by talking to him or her on the phone. The nurse should not make decisions about client needs unless the nurse talks to the client. 31. A low-salt diet is used to treat arterial hypertension, but it is not the priority intervention. 2. The priority intervention for the client with arterial hypertension is to take antihypertensive medications. 3. Taking and documenting blood pressure readings is important, but it does not treat the arterial hypertension, therefore, it is not the priority intervention. 4. Walking will help decrease the client's high blood pressure in some situations, but it is not priority. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis making nursing decisions. All options are plausible in questions that ask the test taker to identify a priority intervention. The test taker must identify the most important intervention. 31.1. Stockings should be applied after the legs have been elevated for a period of time when the amount of blood in the leg vein is at its lowest. Applying the stockings when the client is sitting in a chair indicates the home health aide does not understand the correct procedure for applying compression stockings. 2. If a finger cannot be inserted under the proximal end of the stocking, the compression hose is too tight, and the worker does not understand the correct procedure for applying the stockings. 3. The toe opening should be placed on the plantar side of the foot. Placing the toe opening on answers 64. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. The top side of the foot indicates the aide does not understand the correct procedure for applying compression stockings. 4. Warm toes mean the stockings are not too tight and there is good circulation. Checking that the toes are warm indicates the aide understands the correct procedure for applying the compression stockings. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, evaluation, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse must ensure the UAP can perform any tasks that are delegated. It is the nurse's responsibility to evaluate the task, demonstrate, and/or teach the UAP how to perform the task. 32.1. The nurse should first take care of the bite and then determine whether the dog is up to date on the required vaccinations. The nurse should be concerned about the possibility of rabies. 2. If the dog is not up to date on the required vaccinations, then the veterinarian should be notified to quarantine the dog to check for rabies. 3. The nurse should complete an occurrence report and document the dog bite. If the nurse must pay for anything concerning the dog bite, it should be covered by workers' compensation. 4. Besides an infection of the dog bite, the worst complication would be the nurse contracting rabies. If the dog is up to date on the required vaccinations, then this should not be a concern. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application making nursing decisions. The test taker shall apply the nursing process when the question asks, which intervention should be implemented first. If the client is in distress, do not assess. If the client is in distress, take action. 33.1. This would not warrant immediate intervention because intermittent claudication, pain when walking, is the hallmark sign of arterial occlusive disease. 2. This comment warrants immediate intervention because the client's legs have decreased sensation secondary to the arterial occlusive disease, and a heating pad could burn the client's legs without the client's realizing it. The client should not use a heating pad to keep the legs warm. 3. Hanging his or her legs off the bed helps increase the arterial blood supply to the legs, which, in turn, helps decrease the leg pain. This comment would not warrant immediate intervention by the nurse. 4. Hair growth requires oxygen, and the client has decreased oxygen to the legs. Therefore, decreased hair growth would be expected and not require immediate intervention. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, evaluation, client needs, physiological integrity, physiological adaptation, cognitive level, analysis making nursing decisions, when the question asks, which warrants IMM. Immediate intervention, it is an accept question. 3 of the comments indicate the client understands the teaching and 1 indicates the client does not understand the teaching. 34.1. The nurse cannot purchase supplies for the client. This is crossing a professional boundary. 2. The social worker does assist with financial concerns and referrals for the client, but purchasing smoke detectors is not within the social worker's scope of practice. 3. The nurse should not encourage the client to be dependent on family members for purchasing supplies for the client's home. This may be a possibility when all other avenues have been pursued. 4. The nurse should contact the fire department. Many fire departments will supply and install smoke detectors for people who cannot afford them. The nurse should investigate this option first because it is the most immediate response to the safety need. Content, medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment. Safety and infection control, cognitive level, application making nursing decisions, the nurse must be knowledgeable of emergency preparedness in the hospital as well as in the community. Employees receive this information in employee orientation and are responsible for implementing procedures correctly. The NCLEX-RN registered blueprint includes questions on safe and effective care environment. Chapter 3 Peripheral Vascular Management 6535. 1. The nurse should document the objective findings in the chart, but this is not the priority intervention. 2. The nurse cannot force the client to talk about the situation. 3. The bruises and burns should make the nurse suspect elder abuse, and the nurse is mandated by law to report this to Adult Protective Services. 4. The nurse should let Adult Protective Services take pictures of the suspected abuse because there is a legal chain of custody that must be followed if the case goes to court. Content, medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application making nursing decisions, the NCLEX-RN registered blueprint includes nursing care that is ruled by legal requirements. The nurse is legally obligated to report possible child abuse or adult abuse. The nurse must be knowledgeable of these issues. 36.1. Aspirin, an antiplatelet agent, puts the client at risk for bleeding. The client diagnosed with deep vein thrombosis will be on warfarin, Coumadin, an anticoagulant, which puts the client at risk for bleeding. Therefore, this comment requires immediate intervention by the nurse. 2. The client should wear a medical alert bracelet to notify any emergency HCP of the client's condition and medication. This statement would not warrant immediate intervention. 3. Most books recommend not eating green, leafy vegetables that are high in vitamin K, because doing so is the antidote to Coumadin toxicity. The client would have to eat green, leafy vegetables more than twice a week to counteract the Coumadin. Therefore, this comment would not warrant immediate intervention as much as the client's taking of daily aspirin. 4. Elevating the client's legs would not warrant intervention by the nurse. Content, medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, evaluation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis making nursing decisions. This question asks the new RSE to identify which statement warrants immediate intervention, which indicates 3 of the options are appropriate for the disease process or disorder and 1 is inappropriate. This is an accept question, but it does not say all the options are correct except. 37.1. The nurse should be a client advocate and support the client's wishes, not support the HCP's recommendation even if it is best for the client. 2. Recommending the client talk to his family may be an appropriate action, but it does not support the nurse being a client advocate. 3. The client does have a right to a second opinion, but this action is not supporting the client's decision not to have an amputation, and thus is not client advocacy. 4. This action shows the nurse being the client's advocate. Offering to go talk to the HCP about the amputation and making sure the HCP hears the client's opinion is being a client advocate. Another discussion may change the client's decision, but either way, client advocacy is supporting the client's decision. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis making nursing decisions. There will be management questions on the NCLEX-RN registered addressing client advocacy. A client advocate acts as a liaison between clients and healthcare providers to help improve or maintain a high quality of healthcare. 38.1. Crying at a death is a universal human response. Although the statement may be true, the nurse should recognize the UAP's need for a short time to compose him or herself. 2. Hospital personnel are not immune to human emotions. The UAP needs a short time to compose him or herself. The nurse should offer the UAP compassion. If this occurred with every death, the UAP could be counseled to transfer to a different area of the hospital. 3. This is not accepting the UAP's feelings. 4. This is not accepting the UAP's feelings. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. There will be management case. Shins on the NCLEX-RN registered. In many instances, there is no test-taking strategy. Answers 66. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. For these questions, the nurse must be knowledgeable of management issues. 39.1. Clients receiving hospice can decide to discontinue the service and resume standard health care practices and treatments whenever they wish. The nurse should assess the client's wishes before continuing. 2. This is true, but if the client wants to be treated, it is the client's decision. If the client does not want treatment, then the nurse should discuss the client's wishes with the long-term care facility staff. 3. If the client does not want treatment, then the nurse should discuss the client's wishes with the long-term care facility staff. 4. If the staff continues to try to get the client to accept futile treatment, a client conference should be called. This is not the first action for the hospice nurse because a client conference is a scheduled event and would not take place immediately. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis making nursing decisions. This question requires the test taker to have a basic knowledge of hospice and hospice goals. The nurse must also be aware of basic referrals. 41. Telling the family over the telephone could cause the client's significant other to have an accident while driving to the hospital. The nurse should avoid disclosing this type of information over the telephone. 2. This response allows the family/significant other to know there has been some incident, but it does not disclose the death. This is the best statement for the nurse at this time. The family will be able to arrive safely at the hospital before hearing the news their loved one has died. 3. Telling the family over the telephone could cause the client to have an accident while driving to the hospital. The nurse should avoid disclosing this type of information over the telephone. 4. This is a backward way of telling the family that the client died and should be avoided. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, application making nursing decisions. There will be management questions on The NCLEX-RN registered. In many instances, there is no test-taking strategy for these questions. The nurse must be knowledgeable of management issues. 41.1. The client is experiencing a complication of the surgical procedure and should be assigned to a nurse who is more experienced in caring for clients with vascular complications. 2. Low back pain could indicate a leaking abdominal aortic aneurysm and should not be assigned to a floating nurse. A more experienced vascular nurse should care for this client. 3. Since this client needs extensive teaching, this client should not be assigned to a floating nursing but a more experienced vascular nurse. 4. The client with varicose veins would be expected to have deep aching pain in the legs, therefore, the nurse who is being floated to the vascular unit could be assigned to this client. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The nurse should assign the most stab-le client to the least experienced nurse. 42.1. Leaving the facility will make client care even more strained. 2. The nurse should notify the supervisor that the nurse is concerned that the assignment will not allow the nurse to provide adequate care to any of the 3 clients. This is the first step the nurse should implement. 3. This is the second step. The nurse should put his or her concerns in writing and send the documentation to the supervisor. In states that have a safe harbor clause in the Nursing Practice Act, this will prevent the nurse from losing his or her license should a poor outcome result from the assignment. 4. If the staffing continues to be unsafe, the nurse may choose to resign, but the resignation should follow accepted business practices. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. There will be management case. Shins on the NCLEX-RN registered. In Chapter 3 Peripheral Vascular Management 67 many instances, there is no test-taking strategy for these questions. The nurse must be knowledgeable of management issues. If the nurse thinks the assignment is a violation of the state's Nursing Practice Act, then the nurse must notify the supervisor immediately. 43.1. Morphine is a potent narcotic analgesic. A 4 on the 1 to 10 pain scale is considered moderate pain and should be treated with a less potent pain medication. 2. Promethazine is administered for nausea. 3. Hydrocodone is a narcotic analgesic that is less potent than morphine. It has been 5 hours since the hydrocodone was last administered, and no other pain medication has been required by the client. This is the best medication for moderate pain. 4. Ibuprofen may be effective for moderate pain, but the client is allergic to ibuprofen. The nurse should tag the Medical Administration Record, MAR, and chart to notify the HCP to discontinue this medication. Content: medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. This is an alternate type Q. Question included in the NCLEX-RN registered blueprint. The test taker must be able to read a medication administration record, MAR, must be knowledgeable of medications, and be able to make an appropriate decision as to the nurse's most appropriate intervention. 44.1. The daughter lives in a nearby city. The client should not be moved anywhere until the daughter arrives. 2. A morgue is a difficult place to view a body. This could be appropriate if the daughter was going to take hours to days to get to the hospital. 3. Many people feel it is necessary to view the body. Not allowing the daughter time to view the body before transfer to a funeral home or the morgue could cause hurt feelings and impede the grieving process. 4. Many people feel it is necessary to view the body. Not allowing the daughter time to view the body before transfer to a funeral home or the morgue could cause hurt feelings and impede the grieving process. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application. Making nursing decisions, the nurse should always try and support the client's or family's request, if it does not violate any local, state, or federal rules and regulations. This is the test taker's best decision if unsure of the correct answer. 45.1. The change process can be compared to the nursing process. The first step of each process is to assess the problem. Assessment involves collecting the pertinent data that support the need for a change. 2. The second step is to identify the problem or, in the nursing process, identify possible nursing diagnoses. 3. The third step is to select an alternative to implement to fix the problem. This is similar to choosing a specific nursing diagnosis. 4. The fourth step is to implement a plan of action. This is similar to implementing the nursing care plan. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis. Making nursing decisions, assessment is the first step of the nursing process, and the test taker should use the nursing process or some other systematic process to assist in determining priorities. 46. 2 and 3 are correct. 1. The only solution compatible with blood is normal saline. Dextrose causes the blood to coagulate. 2. The blood administration set is changed after every 2 units. 3. The nurse must assess the client's vital signs before every unit of blood is administered. 4. The nurse should assess for allergies prior to administering medications. Before administering blood products, the nurse should assess to determine compatibility with the client's blood type. The client may have an incompatible blood type, but this is not an allergy. 5. A blood warmer is used when the client has identified cold agglutinins. This is not in the stem of the question. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, physiological integrity, safety and infection control, cognitive level, application. Making nursing decisions, this is an alternate type of question included in the NCLEX-RN registered. The nurse must be able to select all the options. Answers 68. Prioritization, delegation, and management of care for the NCLEX-RN registered exam that answer the question correctly. There are no partially correct answers. 47.1. The client with a deep vein thrombosis is placed on strict bed rest and should not have any type of pressure on his or her calf, which may cause the clot to dislodge and cause a pulmonary embolus. This task should not be delegated to an unlicensed assistive personnel, UAP. 2. The number one intervention for a client with thromboangiitis obliterans is to stop smoking, therefore, this task should not be elevated. The UAP should be on the unit caring for clients, not outside to allow a client to smoke. 3. The leg should be elevated to prevent postoperative edema. Therefore, this task could be delegated to the UAP. 4. The UAP cannot perform Doppler studies, a trained technician must perform this test. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. Making nursing decisions, an RN cannot delegate assessment, teaching, evaluation, medications, or an unstable client to a UAP. Tasks that cannot be delegated are nursing interventions requiring nursing judgment. 48.1. Only the client should activate the PCA pump. Allowing family or significant others to push the button places the client at risk for an overdose. 2. The nurse is acting appropriately, there is no reason to discuss the instructions further. 3. The nurse is acting appropriately, there is no reason to discuss the instructions further. 4. The nurse is acting appropriately, and there is no reason to discuss the instructions further. The charge nurse should continue with other duties. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. There will be management case shins on the NCLEX-RN registered. In many instances, there is no test-taking strategy for these questions. The nurse must be knowledgeable of management issues concerning personnel. The nurse is responsible for evaluating the behavior of subordinates when caring for clients. 49.1. This client may be having phantom pain, but it must be assessed and the client must be medicated. The nurse should assess this client first. 2. The client's blood pressure must be taken to determine if the headache is due to hypertensive crisis, but it is not priority for postoperative surgical pain. 3. The client with lymphedema would be expected to have edema of the lower leg, therefore, the nurse would not assess this client first. 4. The client with gangrene would be expected to have a foul-smelling discharge, therefore, this client would not be assessed first. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions, when deciding which client to assess. RST, the test taker should determine whether the signs/symptoms the client is exhibiting are normal or expected for the client's situation. After eliminating the expected option, the test taker should determine which situation is more life-threatening. 51. The LPN should not administer the medication if the client's BP is less than 90/50ths, but this is not the first action the nurse should take. 2. This medication cannot be crushed and the nurse needs to intervene and correct the LPN's behavior. 3. The LPN should be shown where to find pudding or applesauce to mix in crushed medications, but this medication should not be crushed. 4. The XL in the name of the medication indicates that this medication is a sustained-released formulation and should not be crushed. The nurse should speak directly with the LPN to correct the behavior. Content: medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application making nursing decisions. The nurse must be aware of interventions that must be implemented prior to administering medications. The nurse must know which medications cannot be crushed. The nurse is responsible for evaluating the behavior and actions of their subordinates. Chapter 3 Peripheral Vascular Management 6951. 1. This is an example of paternalism or beneficence. 2. This is an example of beneficence. 3. This is an example of non-malfeasance or beneficence. 4. This is an example of autonomy. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, application making nursing decisions. The NCLEX-RN registered blueprint includes nurse-in G care that addresses ethical principles, including autonomy, beneficence, justice, and veracity, to name a few. 52.1. This would be culturally sensitive to a client who is a Jehovah's Witness. 2. Mormons do not wear amulets. 3. The devout Mormon client wears a religious undershirt that should not be removed. This action indicates cultural sensitivity on the part of the nurse. 4. Mormons do not consult curanderos. Some Hispanic cultures consult curanderos. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, application making nursing decisions. The NCLEX-RN registered blueprint includes nurse-in G care that addresses cultural diversity. The nurse needs to be aware of cultural differences. 53.1. These ABGs show respiratory acidosis, which needs immediate intervention, therefore, this client should be assessed first. 2. The client with Raynaud's phenomenon would be expected to have bluish, cold upper extremities, therefore, the nurse would not need to assess the client first. 3. The client with chronic venous insufficiency has ulceration on the feet. Therefore, this nurse would not need to assess the client first. 4. The PTT is 1.5 to 2 times the normal, therefore, the nurse would not need to assess this client first. Normal PTT is 39 seconds, therefore, therapeutic PTT is 58 to 78. Content, medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis making nursing decisions. The test taker must determine which sign/symptom is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. 54.1. The client with arterial occlusive disease dangles the feet off the side of the bed to increase the blood supply to the legs, therefore, a less experienced unlicensed assistive personnel, UAP, could care for this client. 2. The nurse should be assigned to care for this client, who is angry about the families not visiting, because the client requires assessment, nursing judgment, and therapeutic communication and intervention, which are not within the UAP's scope of practice. 3. This client requires an experienced UAP who is skilled in client lifts, so the client is lifted safely and the UAP is not injured in the process. The most experienced UAP should be assigned this client. 4. The experienced UAP could care for this client, but then other UAPs would not learn to care for the client. This client should be rotated through the UAPs so that all the UAPs can learn to care for the client who is particular about the way things are done. Content, medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. When the test taker is deciding which option is the most appropriate task to delegate/assign, the test taker should choose the task that allows each staff member to function within his or her full scope of practice. Remember, the RN cannot delegate assessment, teaching, evaluation, medications, or an unstable client to the UAP. 55.1. Chest pain on deep inspiration is a symptom of pulmonary embolism. The nurse should first place the client on oxygen. 2. The first intervention is to provide the client with oxygen. The test taker should not assess when the client is in distress. 3. The respiratory therapist can be notified, but it is not the nurse's first intervention. The nurse should first address the client's needs. 4. The nurse should not select equipment over addressing the client's needs. Content, medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis answers 70 prioritization, delegation, and management of care. F. Or the NCLEX-RN registered exam making nursing decisions. The nurse should remember, if a client is in distress and the nurse can do something to relieve the distress, that should be done first, before assessment. The test taker should select an option that directly helps the client's condition. 56. 2, 3, 4, and 5 are correct. 1. Monetary need is not a good reason to select a nurse to become a preceptor. 2. The nurse should be able to organize his or her own workload before becoming a role model for a new nurse. If the nurse is not organized, taking on new responsibilities will be very frustrating for the preceptor and for the preceptee. 3. The nurse who acts as a preceptor should have good people skills and be approachable. 4. The nurse should consistently provide quality care that others should emulate. 5. The nurse should be willing to take on this responsibility or the preceptor will resent the new nurse. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. This is an alternate type of question. Included in the NCLEX-RN registered. The nurse must be able to select all the options that answer the question correctly. There are no partially correct answers. 57.1. This client is experiencing neurovascular compromise and requires immediate attention. The client with venous problems should have palpable pedal pulses. This procedure is for clients with varicose veins. 2. The calf pain is expected with a client diagnosed with deep vein thrombosis, therefore, the nurse would not assess this client first. 3. The client with Raynaud's phenomenon has coldness and numbness in the vasoconstriction phase followed by throbbing, aching pain, tingling, and swelling in the hyperemic phase. The nurse would not see this client first since these are expected signs/symptoms. 4. Berger's disease, thromboangiitis obliterans, is often confused with peripheral arterial disease, PAD. As the disease progresses, rest pain develops along with color and temperature changes in the affected limb or limbs. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. The test taker must determine which sign/symptom is not expected for the disease process. If the sign/symptom is not expected, then the nurse should assess the client first. This type of question is determining if the nurse is knowledgeable of signs/symptoms of a variety of disease processes. 58. Answer: 2050 ml total intake. The urinary output is not used in this calculation. The nurse must add up both intravenous fluids and oral fluids to obtain the total intake for this client. 950 plus 200 equals 1154 fluids, 1 ounce equals 30 ml, 16 ounces times 30 ml equals 480 ml, 8 ounces times 30 ml equals 240 ml, 6 ounces times 30 ml equals 180 ml. 480 plus 240 plus 180 equals 900 oral fluids. Total intake is 1150 plus 900 equals 2050. Content: medical/surgical, category of health alteration, cardiovascular, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis making nursing decisions. This is an alternate type CHU. Question included in the NCLEX-RN registered. The nurse must be knowledgeable on how to perform math questions. 59.1. Cold water causes vasoconstriction and hot water may burn the client's feet, therefore, warm water should be used and the feet should be cleaned daily. This indicates the client understands the teaching. 2 shoes should be purchased in the afternoon when the feet are the largest. This indicates the client understands the teaching. 3. This statement indicates the client needs more teaching because knee-high stockings will further decrease circulation to the legs. 4. The client should not elevate legs because it further decreases arterial blood flow to the legs. The client should dangle his or her legs off the side of the bed, which increases arterial blood flow to the lower extremities. This indicates that the client understands the teaching. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, evaluation, client needs, physiological integrity, physiological adaptation, cognitive level, analysis making nursing decisions. When the question says needs more teaching, it is an accept question. 3 of the comments indicate the client understands the teaching. Chapter 3 Peripheral Vascular Management 71 and 1 indicates the client does not understand the teaching. 61. The nurse cannot delegate a client who is unstable to the unlicensed assistive personnel, UAP. The client is experiencing hypoglycemia and is not stable. 2. The client is stable and elevating the feet is an appropriate intervention for a client with venous problems. Therefore, the UAP could feed this client. 3. The nurse cannot delegate a client who is unstable to the UAP. The client has numbness of the right arm and should be assessed by the nurse. 4. The client with an abdominal aortic aneurysm should not have any increased pressure in the abdomen because it may cause the aneurysm to rupture. Therefore, this should not be implemented by anyone. Content: medical/surgical, category of health alteration, peripheral vascular, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis making nursing decisions. This is an accept question. The test taker could ask which task is appropriate to delegate to the UAP. 3 options would be appropriate to delegate and 1 would not be. Remember, the RN cannot delegate assessment, teaching, evaluation, medications, or an unstable client to the UAP. 61.1. The nurse needs to intervene because the client is at high risk for developing pneumonia, especially due to the abdominal incision. 2. The client must have 30 ml urinary